What was the impact of this treatment in general? The Bortezomib-based treatment is, as induction, still the standard in Europe. We have VCD or VTD. However, also here we all agree that we would like to go for the RVD induction. Tandem transplant is still a valid manner of consolidation or a form of consolidation. There are other strategies around. And for the maintenance issue, we showed in our trial that patients who continued the lenalidomide over 2 years, regardless of response, had an overall survival benefit. And we could show in a subsequent analysis that this was really driven by the patients in complete remissions continuing, so that there is a clear need to continue maintenance treatment even if a complete remission is achieved, because we are convinced that we can convert those patients into negativity for the minimal residual disease.